Hi, I'm Dr. Joe Valenzi. I wanted to talk to you about what a new patient exam means for us here at White Wolf Dental Group. Your experiences at getting new patient exams in some dental offices probably go something like this, where you are scheduled with a hygienist, they take a few x-rays, the dentist comes in after you've had your teeth cleaned, and the dentist mumbles a few things to the hygienist and then leaves, and you're presented with a list of work that needs to be done. That may be a very thorough exam. The dentist may have diagnosed everything properly, but that's not really what I think that I would want for myself or for a family member if they were to go to a dentist's office. And that's the ultimate criteria here for all the treatment that we do, which is what would I want for myself or my family members. So what that means to me is this. When you come in first, we need to take the necessary x-rays, but no more than the necessary x-rays. So depending upon the x-rays that you bring in with you or the x-rays that we can have transferred to our office, we want to see a few intraoral x-rays. Those are the little ones that are good for diagnosing cavities. And then we want to take our three-dimensional scan because that's best for looking at bone height for implants, the health of your gums, the shape of the bone, evaluating how old root canals are, your sinuses. I mean, it tells us all kinds of things that are really important for the kinds of complex treatment that we're often faced with. And it's what I think is essential for an exam these days. So we want to take necessary x-rays, and then we're going to do a thorough exam, including looking for anything that is abnormal with your soft tissues, meaning oral cancer, growths, things like that. And that's, to me, the most important part of the exam because that's the most potentially life-threatening. We also want to take a full series of photographs. Now we do that because, of course, we want beautiful before and after shots of our work, but more important than that, it's the only way that we can document many things that go on in my patients' mouths that you can't capture with x-rays and you can't capture with notes. For example, many patients have gum erosion. It's very hard to measure that. And then 2 years later, we're looking at you and we're noticing some erosion. It's very easy to go back to your old photographs and say, oh yeah, that looks pretty much unchanged, or wow, you know, you've had a lot of erosion since then. We need to really do something, or what's happening in your mouth that's causing this. It also allows me to go back and at my leisure, after I've done the complete oral exam, to look at your x-rays, look at your photographs, and come up with a treatment plan that's appropriate for you. Some people have very simple needs or need no treatment whatsoever, but many of our patients come in with complicated problems that there are more than one solution for, and I spend time reviewing those scans and x-rays and intraoral photographs and trying to work through in my mind what treatment will really work, what all of your options are, so that when you come back for your consultation, we can come up with some treatment plans that make sense and that you understand. That second visit, that consultation, is never at any charge to our patients, and that's important. It's very important for me that we sit down and you know exactly what your problems are, what the options are for fixing things or for not doing any treatment, and that you know the time that it's going to take, what the results are going to be like in the end, what the chances are for success, and of course the cost. Only then, after you've got a thorough understanding of that we have a good roadmap, a good treatment plan, then we can proceed. And then whether you proceed quickly or proceed slowly, it's up to you. But you understand what needs to be done and it makes sense to both of us. And we both come to a mutually agreeable course of action. So, we do a thorough exam, we have thorough documentation, and we have a no-charge consultation. That's all part of what a typical new patient experiences in our office. Now notice I didn't say anything about it. Cleaning. Sometimes we can clean our patient's teeth at that first visit. If you are under regular care and your teeth are essentially healthy, you just have some stain and some calculus on your teeth, then we can often clean your teeth at that visit. However, we don't always expect that because many people come to us after not having been to the dentist in many years. And in those cases, you don't need a healthy tooth cleaning, you need gum therapy. You might need something called scaling and root planing, or you might need gum laser treatment, or who knows what you need. But we can't possibly schedule that for that first visit because that's a shorter or longer amount of time. So forgive us if we don't always clean your teeth at that first visit. It's, again, most important for us to figure out where you're at and to figure out a way forward on your treatment to get you healthy and to have your teeth looking at their very best. Thank you very much, and we look forward to seeing you at White Wolf Dental Group and giving you an experience that you've not had at other places.